What are we really seeing when it comes to the results of these lockdowns, and what has the data told us so far about so many of these expert predictions when it comes to COVID-19 and how we're supposed to handle it? We're joined now by Phil Kerpen. He's a syndicated columnist and also the president of American Commitment. Phil, thanks for making the time.
Great to be with you, Buck.
Let's talk about schools first. What does the data tell us about school lockdowns at this stage, or I should just say school closures? It's not even really lockdowns, closing schools and doing only virtual learning.
Probably the single biggest policy mistake of the entire year, which is saying a lot because we've had a lot of policy mistakes. It's interesting. The original CDC guidance on schools was really balanced, and I think anyone who actually read it and paid attention would not have closed schools. And yet we had sort of this panic contagion that swept the whole country, and all the schools were closed, and a lot of them never reopened or opened on very limited part-time schedules. And it's interesting. There was a study in the Journal of the American Medical Association a couple of weeks ago. They looked at just the impact of elementary school closures, and just for 2 months in the spring, and they calculated 5 million years of life lost from 2 months of elementary school closures, which is probably more years of life lost than we're going to have from the coronavirus. There's a very strong relationship between educational attainment, not just income, but life expectancy as well. The difference between a high school graduate and a high school dropout on average is about 5 years of life expectancy. The online learning is not working for a lot of people. For some kids, it's fine. Some of them are doing okay, but a lot of kids are failing, a lot more kids than ever failed with traditional school. And that has major long-term consequences, both economic and health consequences. And so we're essentially imposing enormous harms and enormous costs on children societally, even though children are at a near zero risk, certainly much lower risk with coronavirus than they are from seasonal flu, which is 5 to 10 times more deadly for children than coronavirus, and that we tolerate and that we think is a perfectly acceptable low level of risk. And so children have really been the biggest losers in our policy response to COVID.
It feels increasingly, Phil, like the elimination of any tolerable risk when it comes to COVID has been at the center of a lot of the policies that we see. And restaurants in New York City have just been closed as of this week. Contact tracing showed that they were responsible for, they believe, about 1% of the spread. So what have we learned about where is the virus spreading in New York and its environs? Because that's also a good proxy for where it would be spreading in other densely populated parts of the country.
Well, the data that New York published, and it's interesting because they published, very, very similar data back in May and then ignored it. And now they're finding the same thing again, which is almost all of the spread is inside of homes, inside of households. And, New York, of course, has a lot of high density residential, a lot of multifamily, apartment buildings. And so, it may be a little bit different there than some other places. But by and large, I think it's now pretty clear from the contact tracing we've seen all over the country that there's not a lot of spread in places like restaurants and retail and so forth. The spread tends to happen, sort of the one-to-one, person-to-person spread tends to happen inside of homes. Now, we also have this other problem of these occasional sort of super spreader events, which are hard to predict, and we still don't really know why some small percentage of people with this virus, and it's only maybe 10%, something like that, seem to be responsible for, a lot of the spread. And so, you got the average person who gets this virus infects 0 or 1 other people. But then you've got this small group that infects tons of people. And, we still don't really know what makes them different and why they tend to infect lots of people. And I wish more research were going into that, because that would be very useful to sort of identify and be able to predict what those characteristics are. But by and large, what we saw in the New York data, and it was remarkable because Governor Cuomo came out and he said, look, here's the data, 75% of transmission is in homes, 1% is in restaurants, so I'm closing restaurants. And, then he said, well, because it's something we can do. We can't close homes, we can close restaurants. But of course, just because you can do something doesn't mean that it's actually, he said, it's only a small difference, but it's something we can do. But if you look at the data, Buck, it's more likely to be a negative difference than a positive difference, because if you say, we're going to push gatherings and holiday gatherings and dinners and all this kind of stuff out of restaurants where people are being very strict with their distancing and their hygiene and all this stuff, we're going to push them out. We're going to close. Now they're going to take place in homes instead. Some of them won't take place at all, but a lot of them will take place in homes instead without any of those precautions. And so in my judgment, the restaurant closure is not only economically devastating, but it's more likely to increase transmission than to decrease it, because people are going to meet in home settings instead.
Well, this was a concern also last winter or late in the winter, when we recognized that New York City was facing this first big wave of COVID cases. They went into the 15 days to stop the spread and the stay-at-home orders. And a lot of people are saying, well, hold on a second. This virus is all over the place already. And now what you're going to be doing by shutting down the schools, shutting down anywhere places for people to go, is you might actually be forcing, and you mentioned multi-generational, multi-family homes, dense housing, which is all over New York City, where it's very difficult to really stay far away from others. It may have effectively sent everyone home to infect their family members inadvertently, but that was always a concern.
Yeah, I think that that almost certainly was a big part of what happened in New York back in the spring. Now, the good thing you've got going for you now in New York is, so many people have already had it. You have a very high level of community immunity, probably higher than anywhere else in the United States. And so, if you look at the New York State numbers, it's now mostly outside of the New York City area. It's sort of the rest of the state is kind of catching up. New York City, if you look at the hospital utilization and the emergency room data, you've actually got lower emergency room visits for respiratory illnesses and influenza-like illness now than in any of the previous 5 years this time of year. So you're actually lower than normal in New York City, I think, because you've got a lot of community immunity to COVID, and because the other factor, which is happening everywhere in the world right now, with very little attention paid to it, there's almost no flu activity this year. And we don't know if that's because the policy measures like the masks and the distancing and school closures are somehow more effective for flu than they are for COVID, or if the virus itself has somehow disrupted. We don't really know why it's the case, but it's a remarkable story, because remember, the experts said we're going to have this twindemic, flu's going to hit at the same time as COVID, all the hospitals are going to be overwhelmed. Instead, we've got the mildest flu season since at least 2015, and maybe, we'll see if it doesn't take off at all, maybe the mildest flu season on record. So you've got, really underutilization of hospitals in a place like New York City that has relatively little COVID activity because we're not seeing any flu.
I pulled some numbers last week. I'm glad you brought that up, Phil. And we're speaking to Phil Kerpen, syndicated columnist, journalist. And Phil, I looked at the initial. Now I had I've had people write into me since to say we're not really testing for flu the way that we normally do. And to that I say, okay, because I am asking. Sometimes people are asking a question and they're really trying to push a conclusion. I'm actually asking the question, but I posed to the audience. I said, the initial data on the CDC website for the first week of December. And I think it was low for what they actually had for COVID. So this was initial data. So the numbers are clearly going to go up. And, maybe it went from, maybe might even go up by a factor of 10, let's say, right? I mean, it could go up substantially. But the initial data said that they had something like 2,000 plus COVID deaths in the first week of December that were officially COVID, meaning that this is they had three from the flu. Now, I could understand more COVID. But there's clearly something going on here. I mean, you mentioned some of the possibilities. There's no way that you have almost a factor of 1,000 more COVID deaths than you do flu deaths, given what we would see in a normal flu season. That's not possible.
Well, flu peaks are more often in January and February than they are in November and December. Sometimes you have, earlier flu seasons. So, a lot of people say, well, flu's not here yet. It's still coming. That might be true, but we've never seen levels this low. And if you look at the CDC flu testing data, it's down about 95%, 95 to almost 100%. Some weeks we've had like 98% reduction from the 5-year average. And it's not that we're not testing. The flu tests are actually higher than the 5-year average, and they're actually at a record high, the number of flu tests that the CDC tracks. And the CDC only tracks clinical labs and public health labs. So they don't track, like the rapid tests in a doctor's office. That's not in the stats. So they only have thousands of tests. They don't have millions of tests. But it's still, it indicates that I think one of three things is going on, Buck. Either we've got the public health measures that are being implemented for some reason are very effective at stopping flu, even though they don't seem to be effective at all for stopping
They're not effective
COVID.
at stopping COVID, right? Go ahead.
Right. So that's a little hard to believe, although a lot of people have been saying that. Or somehow the COVID virus itself disrupts the flu virus, which is possible. There's a phenomenon called viral interference. And this was actually how swine flu ended back in 2009. The rhinovirus came in and it sort of just knocked it out. People got that instead, and it sort of knocked it out. And there was some hope. There was actually an article, months ago, hoping that flu season would come in and sort of disrupt COVID. That definitely didn't happen, but maybe the opposite happened. Maybe COVID disrupted flu. And, once you get COVID, your mucus buildup blocks flu, or some mechanism causes viral interference. Or the third possibility is that we've got some sort of a data artifact where maybe, we get so many false positives for COVID that people get flu, they test false positive, it goes into the stats as a COVID case instead of a flu case. Maybe there's a timing issue where even though we have lots of flu tests, people are only taking the flu test after they get a negative COVID test back, and by then flu's not detectable anymore. Some people have suggested that. So there are three possibilities in my judgment. Either the policies are actually stopping flu somehow, there's actual viral interference, or we've got some sort of a data artifact based on the sequence and the way that we're doing the testing that's causing the flu cases to be mischaracterized as COVID. So it's got to be one of those three things. I'm not sure which it is or if it's a combination, but I wish there were a lot more curiosity about this, among the media and among the public health officials, because it's a pretty remarkable phenomenon, what we're seeing in the flu numbers.
Talk to me about this. And we're speaking to Phil Kerpen. He is the president of American Commitment, and he's a syndicated columnist. Phil, I see all these charts, and I've looked at some of the data myself, and they show mask mandates going into place on a timeline, and for a state, right, whether it's California or Hawaii or New York or wherever, mask mandate goes into effect. And then you have countless charts where you just give it time and the cases just skyrocket after the mandate goes into effect. What can we just tell from the numbers about this as a policy? Can we draw any conclusions, or can you draw any conclusions from what we're seeing?
I don't think masks have any effect. Mask mandates, we should differentiate the two. Mask mandates and masks are not necessarily synonymous, because just because a mandate's in an area doesn't mean everyone's wearing them or wearing them properly or handling them properly and so forth. The reason historically we've never recommended masks outside of medical settings is it's actually really hard to use a mask properly, to make sure you never touch the outside, to remove it and carefully and throw it out or wash it without ever touching the outside. And that's why we've never recommended them in non-medical settings, because even if they work sort of conceptually in sort of a lab test, we never had confidence that people would use them correctly in a way that actually could be beneficial. And I think that based on the data that I'm seeing, it's sort of, you could go either way on whether they work in an idealized setting. There is a lot of lab data showing that they probably would be beneficial if they were used sort of perfectly. But in practice, I don't see any evidence that they've been beneficial at all. And, there's cherry picking that goes on. And the CDC had a couple of very low quality studies looking at Arizona and Kansas, where they essentially just cherry picked their end dates and their comparators and said, look, masks are the reason we saw a decline. And, if you look at kind of what's happened seasonally, you have essentially identical patterns in places with and without mask mandates if they've got the same geography and the same sort of time of year. And so I don't think that they make a difference one way or the other. You could argue, some have suggested they may actually be harmful. The reason that the Nordic states have all avoided the mask mandates, Sweden, Denmark, Norway, and so forth, is they say, look, the mask doesn't really do that much, especially the way a typical person handles it, who's not well trained, the way a surgeon would be, and so forth. But if you tell people that the mask protects you, then suddenly they're going to stand right next to each other for prolonged periods of time with masks on, and they're going to think they don't need to keep their distance, and they're not going to worry about
and I'm sure people that have
and they might go out of the house even if they're feeling sick because they have a mask on.
Right.
And so a false belief that a mask will protect you might actually put you at more risk.
This is what I've been saying. You're going to have people that say, well, maybe I got COVID, but my symptoms aren't that bad, and I'm wearing a mask, so I'm good to go. It's like, no, this is a bad idea. This is a bad idea. But I could guarantee that's been happening all over the country, all over the world. Phil, look, I appreciate that you're willing to take a look at the data here on the numbers and come to conclusions that, aren't right in line with the consensus. I feel like this is the brainwashing that has gone on this issue is unlike anything else I've ever seen in my life. I just want to give you the last word.
Yeah, I mean, probably the most frightening thing of the past year, Buck, has been the extent to which people not only accepted all of these various arbitrary government decrees, but demanded them and welcomed them and cheered them on. And I think the extent to which a large portion of the public supports the heavy-handed, government policy response is probably the most frightening takeaway of this whole thing. And it means we could see this again every time there's a disease. So I am concerned about that, and I share your sentiments on that.
Phil Kerpen, president of American Commitment. Phil, really appreciate it. Talk to you soon.
All right, have a good one.
Hey, Team Buck, thank you so much for watching The First on YouTube. If you like this video, please click that little thumbs up button so then it will log as liked. And also, if you want to see more great content from The First, please click subscribe.